and welcome to Happy Horsemen. My name is Gina. Today we're going to be discussing whether or not to vaccinate for rabies. I believe that all equine should be vaccinated regardless of whether or not there is an endemic in your region or not. And with a little more supportive information, you will see why. Rabies is only occurring in about 5% of horses, but regardless of whether or not it is, again, endemic in your area, you don't want your horse to be one of those unfortunate ones that it does affect. So the causes of rabies, generally speaking, rabies is caused by wildlife. So most commonly, horses come into contact with skunks, and it is transmitted through the saliva, whether being bitten or the saliva contacts an open wound, and then it is infected that way. Also, although skunks are the most common transmitting wildlife, foxes and raccoons have also been known to transmit rabies to horses as well. On the rare occasions, bats and unimmunized dogs and cats can as well. So now that we know the causes and how it is transmitted, we can get into clinical signs of rabies. Typically speaking, rabies can be hosted and not show signs from 2 to 6 weeks. So your horse can be bitten and act completely fine for that time period, and then start showing signs of anorexia, lameness if it's bitten on the leg, swelling. If it's bitten on the leg, they start to gnaw at the leg as well. Then they have a dullness to them, generally showing neurologic symptoms shortly thereafter. And then once signs are showing, they become recumbent and then death at between 5 and 7 days. So generally speaking, because all of our horses are so inquisitive by nature, this puts them at risk because with that curiosity, seeing some form of wildlife in their confinement or their habitat or their pasture paddock stall, they're obviously going to want to go check it out, and that puts them at higher risk in the possibility of them being bitten. So in addition to that, I would also like to add to the fact that once they are bitten, vaccinating right away is not going to do you any good. The horse will not benefit from it because of the fact that due to such a low incubation period, the immunization will not have time for the body to develop an immunity to rabies. So again, all the more reason to vaccinate. Unfortunately, diagnosing rabies in your horse while still with you and living is a little bit difficult, and generally the last diagnosis that your veterinarian is going to look for, because symptoms can commonly mirror that of equine encephalomyelitis, protozoal encephalomyelitis, some forms of equine herpes, and botulism as well, and other diseases and viruses as well. So again, I do recommend vaccinating your horse or any equine for rabies, regardless of whether or not you live in an endemic region. As I said, unfortunately, the outcome once diagnosed is generally not good because there is no antiviral serum to be given to horses or any equine. And if you have found this information helpful or in your decision in vaccinating your horse, please check out my page and subscribe. Thank you, and we look forward to talking to you next Friday.